Hi guys, welcome back to my YouTube video channel. Again, I will show you another presentation on orthodontist case that I have finished about a couple years ago. And I want to go ahead and jump right on so I can show you this case, very interesting. All right, let me share the slide and we'll get started. So this patient here, Asian female, 26 years old patient came into the office with a smile like this. She have, because of the confidentiality, I don't want to show the face and how it looked and everything. But in general, when she came, she was very shy, very, I would say, lack of confidence because how her teeth look. So you can see that she would try to cover up her smile by wearing different kind of glasses, eye glasses, and hairstyle. And everything seemed to be doesn't go together because of the lack of confidence. And these are the side view. And you can, I want to zoom in so you can see a little bit more closer how her facial look. This is, let's see, I want to make sure I got the screen set up for me. All right, that it. Let's see. Yeah, I'm gonna leave it like that. So, the front teeth smile, as you can see right there. She is smiling with, let me go back one slide. Her front teeth, lower teeth is really crowded, upper teeth is really crowded, as you can see from the side view here. A very deep bite on the anterior. Bottom teeth here, you can see it a little really crowded here. I have better picture, but somehow, oh yeah, this is better. As you can see, go back. You can see that upper teeth very crowded. Canine is way out of the arch. Bottom teeth, premolar impacted, little crowded. The simplest way to treat this case is remove 4 bicuspid and get it done fast. Problem is, the patient did not want to remove too many teeth. So we started from, I want to speak on behalf of the general dentist experience that when you do ortho case like this, when you put brackets on and for a few months, and then when you take these bicuspids, it's a lot easier than trying to pull the tooth right away. So painful. Patient will have really like tough experience when you do the type of dentistry where you refer and get somebody pull the teeth. It's really like a traumatic experience. But in this case, when I walk patient through this, she didn't feel pain, discomfort because we started the unraveling the teeth. Before then, when we take out the upper bicuspid, it's really gentle, very easy to remove, really fast. We were gonna take out these two right here and get it done easy, but I will explain to you this during the process of the treatment. Patient decide not to remove any bottom teeth. So here is the case. We etch. We started brackets on, and you can see it's pretty crowded teeth. And the first couple of days, you can see night tie wire unravel these teeth, get the teeth aligned. It takes quite some time to get to every month, a little bit progress. So this is the intraoral photo to begin with. Canine number 11 way up here. And you can see a couple months, canine coming down. Bottom teeth start aligning, and you can see that it show more of the cervical area of lower teeth that indicate that there is making a good progress. Her smile looked a lot better over the first few months. Here is a picture of trying to move this away so I can show you the other side, but it seems like it's not going to move. All right. So the anterior teeth getting better every month. Her smile look better, her canine and everything alike. Making good progress. Deep bite still is a deep bite problem. You will see that there's improvement every month that it go by. Here's another, some of the picture, it could be different months that I messed up orderly in this presentation. Anyway, we have those two upper first bicuspid removed, straight everything up. You can see the difference between beginning to midway. Everything looks straight. As you can see how much improvement with the lower anterior, completely straight. This is something I want to show you. As you can see, I did not put the power chains on top of the brackets, but I put power chain behind it. What the purpose? Purpose was I trying to intrude into lower and anterior incisor. So when you do this, you actually pushing the wire down. You can see the progress of the physis. So here, that's what we do. We're trying to reduce the deep bites. So you can see how much improvement right there that you can see from where the deep bite and now is not deep bite much anymore. Now you have to correct those open space there. How do you do that? Elastic, cross bite elastic, cross arc elastic. So it's very important for patient comfort, a patient compliant. The more you listen to our instruction, the faster the case is going to be. Sometimes patient does not comply. The way to identify whether they comply or not is to give them a bag of elastic and 1 month later tell them to bring it. And you can see how many that in the bag that she still have. If she still have a lot, that means that she doesn't use the elastic. So there's no improvement. Anyway, the progress, we're making good progress. Every time we have problem with compliance, we check and reinforce. And here is the situation where first molar rotated mesially. What you do is you put a lingual click here and put the power chain to pull it. If you pull forward on the lingual, you're going to pull the buccal distal distally, and that's how you correct the rotation of the molar. I'm hoping you understand is the force come this way, it means that the tooth will move backward this way and will correct that rotation right there. Little trick I just want to show you. So here's another view that the patient before and this is after. So big difference, patient a lot more confident, look more charming. The lip, bottom and top show more even. Here she had to restrain her lip on the upper in order to show the teeth here. Here she seemed to be smile quite relaxed. So here's another picture, close shot. Before, deep bite, show a lot of inflammation gum on, but now very nice gum collar on the bottom and the top. We could improve with significant procedures like gingivectomy to make everything even. That is something we propose. Patient haven't decided to get done. If she decide, we are up for taking care of that for her cosmetically. And here is the picture, intraoral before, and here's after. Canine before went way up there, and this tube is just out of alignment. This one is out of alignment, but if you can see that for the most part, we were able to conservatively improve her smile without a major procedure, consider extraction of 2 bicuspid on the bottom. We did not do that. Patient did not want to remove, so we're trying to work it out, arrange the teeth together. We could have improved with gingivectomy right here, little bit right here and a little bit right here. That would give her a perfect look, but she is happy where she is. So there is improvement. As you can see, the relationship of posterior teeth right here, everything is aligned in the proper position. On the left side, right side, same thing. What you see here, that we were not able to achieve maximum intercuspation because the patient did not want to have any enamel reduction, like they call the uh, interproximal strip. We don't do that. Patient didn't want to. So we end up having something like this. Overall, patient happy. Once again, intraoral photo showing that compare what's here before and this after. As long as the patient is satisfied, I'm okay with it. As you can see, the reason that the benefit of having braces for her is not only cosmetically, but as you can see that incisally her teeth become worn out on the upper at lower here due to the deep bite. When you have a deep bite, you will have grinding unconsciously, and so that part of the functional problem that the patient who presented with crowded deep bite, you explain to a patient that is an opportunity to improve a patient's look. So once again, this is upper intraoral. This is what we have right here. Is the I'm trying to move my this in the way, yeah, right, yeah. So you can see there's a lot of improvement there. We only remove this tube here, number 5, number 12, move everything together, put your teeth straight. And bottom teeth, for the most part, we were able to put teeth together, except this one right here. Patient did not want to go through extraction, otherwise I would have remove and correct everything in an alignment state. Patient is happy. So again, thank you for watching. I hope you enjoy this video. Again, this is showing front teeth smile before and after, and also before and after. Great improvement. Patient was aesthetically happy, and she even do the allow us to share the picture. So thank you for being listener for this presentation. If you guys have any questions, feel free to jump on right in, ask me a question, and I'm happy to respond to you guys. And again, thank you for watching, you guys. I see you next video. Have a great one. Bye bye.